every day at 3 to get answers for you in real time. Today, we have the public health officer for Contra Costa County. We'll talk all about the easing of restrictions announced today jointly by Contra Costa, 5 other counties, and the city of Berkeley. So 7 entities altogether. Post your questions on our Facebook live stream, YouTube Live, or check out our Instagram stories to submit your question. So let's get to our guest today. He is one of the 7 public health officers working on guidelines, when to ease restrictions, how to do that. Dr. Chris Farnetano, and I practiced before the show as well. I do want to say thank you so very much because I can only imagine how busy you are, but thank you for making the time for our viewers today.
You're quite welcome.
All right,
Happy to be here.
Thank you so much. Before we get into the questions, let's just go ahead and show folks the biggest changes. These activities will now be allowed starting on Monday, May 4th. I will run through them quickly. All construction projects, real estate transactions, some child care camps, educational recreation programs, outdoor businesses, certain outdoor recreational facilities, golf courses, but with some restrictions, so we'll talk about that. All businesses must update and create social distance protocols. So a lot to talk about, but let's begin with why these activities and why now?
Well, I think the last few weeks have shown that the stay-at-home orders and the cooperation that the public has shown in really pulling together and following these orders and really trying to stay home as much as possible has really successfully bent the curve and prevented a surge of cases that like we have seen in other parts of the country. And so our cases of new COVID-19 or coronavirus cases are stable. The number of patients in the hospital throughout the region are stable or even in some places decreasing. And so we feel we're at the point where we can very cautiously begin to open up some lower risk areas of businesses and other economic activity so that we can start to get step by step a little bit closer to what we kind of saw as sort of normal before this pandemic occurred. But we have to do it very cautiously because we don't want to trigger another surge. The virus is still out there, and if people go back to a lot of close interaction, the virus numbers could shoot up and we could still wind up overwhelming our hospital and leaving a lot of people very sick.
So, Dr. Farnetano, you're saying social distancing protocol will remain in place even as these activities restart. Okay, I do want to ask you some of our viewer questions because they've really been pouring in. We're getting one from Jess asking, are outdoor family photographers allowed to resume?
That's not something that is covered in the current order that's going into effect on Monday. So it does outdoor recreational facilities like golf courses and tennis courts, but we're still asking people not to mix with people who are not in their own families. So that's not something that we're encouraging people to do.
Okay, so you mentioned golf, and that's been a little confusing. Pam also asked about this one on Facebook because the Bay Area counties are saying that's okay, but the state has said no, and our own reporter Liz Kreutz asked the governor about it during his news conference, and all he said was he's going to work with the counties. So what does that mean for golf courses in the county, open or not?
Well, the state order is not really clear on this point. So, according to our local orders, the golf courses are allowed to reopen as long as they follow social distancing protocols as of May 4th. And we want to await some clarity from the state about what the state order specifically allows or doesn't allow it regarding golf, because in the actual order, it's not very clear.
Right. So when it's not clear, is it the state or the county order that applies, or is it the stricter of the two that applies?
The stricter of the two is what applies. So hopefully we'll get a little more clarity from the state as whether their state order truly allows or doesn't allow golf.
Tom Perry wants to know whether youth sports practices with 12 or less could then be played, because some athletic fields will now be open, right? But did you just tell me it's still for only families to use it together, but not for teams or even friends?
Well, in the previous order, there was provisions for child care services that involved 12 children or less in a stable group without any kind of mixing. And this order extends that to include child and youth related educational activities as well as camps. And so if those kind of guidelines can be followed, it's got to be a stable group of 12 children or youth. There's got to be no mixing. The adult supervision also has to be stable and not mixing. Then those kind of activities can go forward, and this will help us kind of plan towards the summertime, and assuming that our numbers continue to be stable, to allow some amount of summer camps as well as small size educational opportunities for kids.
All right, so like a tennis camp, for example, and you have a stable group of kids, and you ensure
Yes.
they're taking proper precautions. But this gets hard with children, right? Terry asked on Facebook about childcare, but this also applies to camps. How can social distancing happen given kids have a hard time keeping their masks on, and you can't really count on them to avoid getting within a few feet of each other?
Yeah, it is challenging, and it's not an area without risk. And so, the 7 Bay Area health officers, in putting forth this new order, we really wanted to try to strike a balance between activities that were low risk, but realizing that some of them do carry risk. So we still encourage as much as possible for people to stay home and stay within their own family unit, but realizing there's a need for children to have some kind of face-to-face educational opportunities. There's a need for childcare for parents who are going to work, and realizing that these are, fairly low-risk activities. Although, even though with COVID-19, children, if they do get the virus, generally have a milder disease. We do worry about children bringing it home to older family members or family members with health conditions. So it is, each family has to make their own judgment. But if you had a family who had a grandparent or someone with chronic health conditions in the family, you may want to think twice about your child participating in a group that's not really that's optional, for concern that they could be bringing home the virus to the family.
Got it. Now, given this extra care and attention to ensure proper social distancing, do you expect that there will be a different teacher-student ratio, if you will?
Yeah, obviously, our traditional way of having schools with classes of 20 or 30 students would not be allowed under this format. So if schools do put together in-person learning opportunities, they're going to be much different than what we're used to seeing. They're going to involve, much smaller groups, and there's going to be social distancing within the groups as much as possible. Understanding that with small kids, it's kind of hard to keep them apart.
Absolutely. All right, we're going to take a short break on air, but let's continue this conversation on our live streams, including Facebook Live right now, and we'll be back on the air in a couple of minutes.
In commercial break for 2 minutes.
All right, Facebook friends, we're on with Dr. Chris Farnetano, the Public Health Officer for Contra Costa County. Let's go ahead and tackle a few more questions. Some folks want to know that are apartment pools going to be allowed to be used?
So any kind of public pools or pools that are sharing between members of different households are not allowed. So we make a distinction in this order between the type of facilities where shared equipment and is not happening, and where people can maintain social distancing. So, for example, golf and tennis is a place where you can not be close together, but a basketball court, it's really hard to play basketball without being close together. And pools, it's really hard to keep people 6 feet apart in pools. There's changing rooms. There is, even if people are swimming laps, one person in a lap, you're passing each other, on the lanes in close distance. So we really thought about this a lot and didn't feel comfortable allowing public pools or community pools at this time.
Okay. You know what? I'm getting so many questions, Dr. Farnetano, on the kind of fields and parks that are now going to be allowed under the new eased up restrictions and ones that are still not allowed. So when we come back on air, if we can do a lightning round where I'll just say the thing, basketball court, and you say yes or no, and then we try to tackle like 20 of them if possible.
Okay. We can try that.
Yeah, I know. We'll try. And then I want to get into some businesses and real estate and construction and things like that.
10,
Okay.
All right.
9, 8, 7, 6, 5, 4, 3.
And we are back with Dr. Chris Farnetano, Contra Costa County's public health officer. Thank you for making the time today after the 6 counties announced some details on how things can start to reopen. And I want to go through a lightning round where I just say the facility and you tell me if that's now allowed or not, because there's so many questions about that. Baseball fields?
No.
Soccer fields?
No.
Tennis courts?
Yes.
Golf courses?
Yes.
Basketball courts?
No.
Ice rinks?
Ice rinks, that would fit into being able to socially distance. So those should probably be allowed.
Okay. How about pools?
Pools, no. Hard to socially distance in pools.
County parks and trails?
Yes, as long as the agency that's overseeing those feels that there's not having problems with crowding and people are safely socially distancing.
Okay. Skate parks?
Same with the state parks. A lot of the state parks are closed because of the concerns of crowding, but if the state park agency decides to leave one open, it's based on their judgment that people are safely socially distanced.
I'm glad you answered that, but actually I think I need to enunciate more because I meant skate parks.
Oh, I'm sorry. Skate parks, yeah. Skate parks can be open.
Okay. How about pools?
Not swimming pools.
How about campgrounds?
I'm sorry, I think I lost your audio feed.
Campgrounds, like camping out in the woods, state parks, or local
No.
county parks?
Campgrounds are not allowed.
How about lakes?
I think that's up to the different parks and the managers of those facilities.
Okay. Gymnastics training facilities?
I have to a little more detail about the type of facility there. Any indoor gymnastics would not be allowed. It's just like gyms, indoor gyms are not allowed.
Okay. Volleyball courts?
No.
Okay. I want to also move on to businesses now because some business activity is being allowed to resume, and real estate is one of them. And I wonder how that can be done because if you're showing houses, open houses, and you're letting somebody into somebody else's residence, how does that work? What are the restrictions?
Yeah, so open houses are not allowed. There can be individual showings by appointment, but the home sellers have to not be present in the home. So the family in that home needs to leave for the afternoon so the realtor can bring a client in, just one person at a time. That way they can keep that social distance going.
Got it. What about construction projects? Do you envision, and how do you envision workers working alongside each other on a big project? I mean, you might need 2 or 3 people to move something, for example. How does that work with social distancing?
Well, in our order, we've attached 2 sets of construction protocols, one for large construction businesses and one for smaller construction businesses. And there's a series of requirements that the construction company needs to follow, including not allowing their workers to carpool together if they're not from the same home, having hand washing stations, requiring everyone to wear masks, requiring everyone to stay 6 feet apart whenever possible. So there's a series of stringent steps they need to do to ensure there's not spread of the virus at the work site or in traveling to the work site.
Okay. What defines a large-scale project?
There's specific definitions in the order and the protocols that define small versus large.
Okay, so if you are someone, a homeowner who's had a reconstruction, remodeling, for example, project that's been on hold for a couple months, that can now resume with proper social distancing between the workers. Okay. Outdoor businesses that normally primarily operated outdoors before this can now resume. So we know that means landscaping, gardening, nurseries. But what about things like outdoor cafes?
Now, cafes are, very different outdoor restaurants because they really involve a lot more extended time and extended contact between the wait staff and the individuals. So outdoor dining is not allowed at this time.
Okay. A lot of people are also asking about dog grooming businesses or dog care businesses. What is your take on that?
Some dog grooming and care is needed for the health of the dog. Certain animals need care for their paws and their nails or their eyes, trimming around their eyes to prevent infections. And if it's a healthcare need, then the dog grooming is allowed. But dog grooming outside of maintaining the health of the pet is not allowed.
Okay. From Instagram, we have a viewer asking, what about dental offices? When are they going to be able to open? My kids also have, Invisalign orthodontics. I know that's been postponed as well. So what about those?
Yeah, our local health orders never restricted routine health care, including dental care, but there was encouragement when the coronavirus pandemic first hit for folks to postpone some routine dental care. Now that this pandemic is continuing on for some time, and now that dental offices, medical offices, hospitals are better prepared to manage the cases as well as put in proper infection control for routine care, we're now really encouraging people to get back to getting that routine care that they've been putting off, whether that's dental care or getting your mammogram or getting your pap smear or getting your routine childhood vaccines. We do want to get people back to resuming those. And a lot of these offices now have good social distancing practices in place, requiring everyone to wear masks, screening people for symptoms. So we feel it's a lot safer now to go in for your routine care.
Okay, that's good to hear. A lot of people are asking about hair salons and nail salons. I know yesterday Governor Newsom put that under stage 3. And he said that, we're currently in stage 1 and some of the things you described are kind of starting up in stage 2. So how far away is that going to be in terms of being able to get a haircut or your nails done?
Can't say for sure right now because we really have to look at this epidemic as it evolves and how the numbers evolve. We're really thinking in the Bay Area that this new order is really getting us to maybe a stage 1.5, not even to a stage 2. But those personal care services really involve very close contact and very high risk for transmission of COVID-19. So that's why they're not allowed at this present time. But hopefully as things improve, we'll be able to move to that in the future.
Okay. I kind of want to go back to that just because so many people consider that very essential. Is there no safe way to do it if both parties, for example, wore a mask and try not to talk to each other and maybe took their temperatures before they engage in that interaction? Is that, still not safe enough?
Well, this is a new and evolving field and trying to understand how these kind of services can be done safely. And there likely will be some sort of protocol that involves masks and gloves and screening before those kind of personal care services. But we've been in a real shortage of personal protective equipment. And there's also concern we want to save that right now for the healthcare providers that really need those. And so as the supply chain of personal protective equipment improves, that'll be one condition that will allow us to roll out protocols for other types of business where they may be able to keep both the workers and the customers safe by using medical grade masks and things like that. But right now we want to save those medical grade equipment for the healthcare workers.
All right, we're going to take a short break on the air, but you can continue our conversation on our live streams right now on Facebook Live or abc7news.com. So join us there.
We're in commercial break.
We are in commercial break with Dr. Chris Farnetano of Contra Costa County Public Health, along with 5 other Bay Area counties and the city of Berkeley. Gave us more of a picture of what's going to happen starting next week as we start to ease some restrictions. I think this is a good time to talk about the health metrics and why, even though the number of deaths, hospitalizations, and ICU bed use, even though they're still kind of steady, so not spiking hugely, but certainly not on the decline, why we feel pretty good about where we are right now to start taking surgical steps towards opening.
Yeah, so these are things that we're tracking really closely. One of our main concerns, and it was a real fear in the month of April, that we were going to get a surge like New York and other parts of the country had that would totally overwhelm our healthcare system. We have successfully flattened the curve, and the hospitals have done a lot of preparation to prepare for an increase in numbers, but the number of patients in the hospital has started to flatten out. But that's a very fragile improvement. And we've seen, like in Los Angeles, the number of cases in Los Angeles last week increased, doubled in about 8 days. And so we have to do this cautiously, because if we open up and loosen up these restrictions too quickly, we can see a surge that still overwhelms our hospitals. So the hospital numbers are a key indicator that we're tracking very closely.
All right, Dr. Farnetano, hold on tight, because we're going to come back on the air in about 10 seconds.
8, 7,
The voice of God,
6,
otherwise known as our
5,
director.
4, 3.
We are back with Dr. Chris Farnetano, the public health officer for Contra Costa County, to clarify what the new order means with some relaxing of restrictions and allowing some activities to come back now. And one thing I want to start with is I actually have a dear friend who lost a family member just a couple of days ago. There is a new rule with regard to funerals, right?
Mm-hmm. The funerals are allowed for 10 people or less, and that was true with the previous order. Also allowed funerals of gatherings of 10 people or less with social distancing.
Okay, so that is not really a change, but I want to talk about public gatherings, or private, I should say. That is still not really allowed, but I want to ask you about some of these things because I've been seeing them in the neighborhood. Friends gathering in parks or even on someone's lawn, sitting about 10 feet apart. Is that okay?
Well, we're still really not wanting to encourage that because, we're still learning more and more about this virus. Staying 6 feet apart is really important. But even gatherings, if there's large gatherings where people are more than 6 feet apart, there's still, the risk is less, but it's not zero. And so, and we've seen some studies of people when they're running or exercising, that sometimes the virus particles can travel even further than 6 feet. So we really don't want to encourage any kind of group gatherings outside of your family household at this time. So, it may be better for phase 2 or phase 3, but not at the phase 1.5 that we're at. So
I guess that applies to friends riding their bikes on opposite sides of the street?
Well, we're trying not to encourage too much of that.
I understand what you're saying. I mean, the idea is to stay as far apart as possible with non-family members.
You want to stay as far apart as possible. That's correct.
Okay. Getting a couple of questions on Facebook right now. Lori wants to know, she works in an office building in San Ramon with multiple businesses within that building, and the bathroom is shared. So is this open or remaining closed, the shared bathroom situation?
Well, indoor businesses are only allowed to be open if they're essential businesses. And so the order has a list of what are considered essential businesses. So, certainly we'd, if there's multiple essential businesses, you want to be careful about overcrowding in a bathroom, trying to maintain your social distance. And hopefully whoever's cleaning the bathroom is cleaning it on a regular basis.
Mm-hmm. I also want to address bars and restaurants because they are still, of course, restaurants takeout only at this point. People are not allowed to sit there and congregate and hang out. But why not consider opening restaurants or allowing them to operate with people sitting down, but just really, really far apart, for example?
Well, even if folks are sitting far apart, there's still interaction with the wait staff, and there's still a lot more close contact. So this may be something that in further phases, again, we want to open up very, very carefully and very slowly, because every change is an unknown, and this virus can so quickly get out of control, like we saw in New York State. The first reported case of coronavirus in New York was on the 1st of April, and by the end of the month, they were overwhelmed with cases. So it can happen just that quickly.
All right. Dr. Farnetano, thank you so much for that. We're going to take another short break on the air and be back with more in just a moment.
We are in break.
We are in break. Okay, and then when we come back on air, do we have more time to chat, or is that it? What is the timing? I'm sorry, 1:45 to chat online, and then when we come back on air, what do we have?
And then we are done with the guests.
Oh, as in no more introduction, just say goodbye to the show then, like say goodbye to viewers.
So we got a minute and a half to continue the conversation.
Online?
That is correct.
How about when we come back on air? Simply say goodbye?
You'll have about a minute 15 to wrap it up.
Oh, I see. So we can talk more for a minute or 45 seconds. So one more question.
Sure.
Got it. Hey, Dr. Farnetano, when we come back, if we have like 45 seconds, what would you like to talk about? That this is a work in progress, or are you going to reevaluate as the numbers come in daily, that kind of thing? Do you want to address that?
Yeah.
Okay.
Sure.
Okay, so we'll do that, and let's see if we can get one more viewer question in. Home outside caregivers still prohibit, in-home, sorry. Inside caregivers still prohibited as well? That's a question. Is it? It's not, right?
Yes, they are.
It is?
They are still prohibited.
Oh, okay. Is it
Unless
safe?
it's construction related.
I'm sorry, say that again?
Unless it's construction related, like you're doing a remodel, those are now allowed.
Okay. Is it safe to walk a small pack of dogs from multiple homes?
There is concern now with new evidence that actually dogs can catch coronavirus and pass it. So we don't recommend mixing dogs from different households as much as that can be prevented.
All right, sounds good. We're going to come back on the air, so hang on tight. Oh, actually, we are done with you. Okay, thank you so very much. I really appreciate all the clarity you provided. It was very, very useful. I appreciate it. Take care.
9, 8, 7. Coming back with a recap in 5, 4, 3, 2, 1.
All right, thanks so much for joining us for this informative session, informative for me certainly, of this new interactive show, Getting Answers. Here's a recap of what's allowed now by the 6 Bay Area counties. Just take a quick look. Basically, construction, real estate transactions, childcare, camps, education, outdoor businesses such as nurseries, landscaping, some outdoor rec facilities like skate parks, athletic fields, soccer fields, baseball, for example, but not swimming pools and not basketball courts. Golf courses, although the state is still saying no to that, so they need to kind of hammer out the details because the stricter rule is supposed to apply. All businesses must operate and create social distance protocol that would enable them to operate safely. What's not allowed? Let's take a quick look. Public-private gatherings of any size. Playgrounds, picnic areas, gyms, dog parks, shared spaces that do not permit physical distancing, bars and restaurants, which remain takeout only at this point. Funerals are allowed, but only limited to 10 people in the gathering. And of course, non-essential travel still not allowed. That's going to do it for now. We'll be here every day at 3 o'clock on air and on our live stream answering your questions. So join us daily. Thanks a lot. Thank you, Facebook friends. Great questions today. I know that in some of them we weren't able to get answers. I think that's because it's a work in progress. So stick around every day. We'll try to get you